We're recording those, and they will be shared with feedback as feedback with the national office. So I just wanted you to know that. I'm Lori Carmen. I am the state director for AARP here in Florida. What I want to do is quickly tell you where we are on health reform and then open it up. AARP is supportive of health reform efforts. We have not endorsed the House proposal or any proposal that has come out of the Senate. We have been working on health reform for quite a while. Since long before we had a new president, I was traveling the state talking to folks like you about the health reform issue. We followed the candidates around the state. We didn't have Democratic candidates for very long, so we followed the Republican candidates around, asking them about health care, asking them to pledge to do something about health care. And we had some strange bedfellows in our work around health care. We actually have been working with the Business Roundtable, who represents large companies, the National Federation for Independent Business, as many of you know, represents small business. And we also worked with the Service Employees International Union. We decided that very different organizations who don't always agree could come together around some basic principles that if we could come together to try and get something done, maybe the folks in Washington could put aside their differences to get something done as well. And so we knew all along that in the end there would be things where we might not agree, but that we would start out together. And in fact, we sent a joint letter to members of Congress a couple days ago asking that we continue to move forward and that we ensure that changes are made that are going to make the system a better system, no matter what age you are and whether you have coverage or not. We came to the table on health reform with 6 key asks. It doesn't mean that's it for us, but there were 6 key asks that we had that were important to us based on what we were hearing from folks like you as we traveled the state and as we traveled the country. The first was coverage for people aged 50 to 64, affordable coverage for those who currently don't have coverage, and affordable coverage for those who are paying but can barely pay those bills. There are approximately 600,000 people in that age group, 50 to 64, in Florida who currently don't have coverage. The economic downturn hasn't helped. Many folks have lost their jobs, and as you get older, it can be more difficult to find work. And you're not quite Medicare eligible, and that proves very difficult. The second is around prescription drug coverage for folks in Medicare. Many folks are on Part D, and after a short period of time, they fall into what's called the donut hole. You hit that $2,700 limit, and the next thing you know, you're paying the full cost of your prescription drugs. So we have asked that the donut hole be closed. Another area around prescription drug. Oops, I thought I lost it. This is an area. Let me try this. That we can continue to hear from folks about as the cost of prescription drugs was creating a pathway for generic biologic drugs. Biologic drugs are drugs that treat cancer, MS, Parkinson's, and currently you can't get the generic forms. The FDA has a 5-year pathway for non-biologic drugs at which they go from brand to a generic option. We had hoped for the same pathway for, and we're still fighting for, that same period for biologic drugs as well. We don't think people should have to wait a decade to be able to afford the cancer drugs they need. Another ask was that long-term care be part of any health reform proposal. Many people don't know until they are caring for an older loved one that Medicare doesn't cover long-term care costs. And so folks don't plan. They don't realize this, and then it's too late. So we want to ensure that people can stay at home and in their communities as long as they want, and that it's affordable for folks to do that. Another ask was that for folks, for low-income seniors who currently get subsidies through Part D, that those programs that help them currently are still available. Many seniors, maybe many of you in the audience, pay as much as 30% of your income in Medicare out-of-pocket costs. And given that our incomes often go down as retirees, and given what the stock market's done lately, that's 30% of an income is a lot of money. So we came to the table and said we want to ensure these things Our concern was that no one else was going to be looking out for Medicare, frankly, and there were conversations about the need to just cut that program across the board, and that raised real issues for us. So we are looking at the proposals very carefully. We're following what's happening, I'm sure, as closely as many of you are. Folks who we've talked to are following these debates every day. And we continue to raise red flags where we need and communicate with our members of Congress here and across the country on health reform. I will say, too, that a lot of the things that we would like to see in reform, we also started working on as separate pieces of legislation. Before a big bill was developed, we went to our members of Congress and asked for bipartisan support on single pieces of legislation that would deal with the long-term care issue, that would deal with the biologics issue, that would deal with Medicare fraud. And so we continue to work that angle as well. With that, I'm going to close so that we can get to the real reason you're here, which is to ask questions. I'm not going to promise you I'll have every answer. When I don't have an answer, I'll get back to you. I'm still following up with folks from Panama City, where I was a week ago. And I also have some able staff who may be able to fill in when I don't have an answer. So with that...
My question is, does AARP support a public insurance option?
We have not taken an official position on the government option. What we have said is with or without the option, we want to ensure affordable quality access for everybody. And for us, our focus, of course, is 50 plus. If the government option ensures affordability, ensures quality, if there's transparency, if it's efficient, if we're talking about a public-private partnership, then it's something we would consider, but we are not wedded to the government option.
This gentleman right here, all right.
Why does Nancy Pelosi in his recent last night Obama say that the AARP supports the House version?
I heard that our president did say that, and our chief operating officer, Tom Nelson, did come out quickly and clarify. We do want health reform to happen. We have not endorsed at the House or Senate proposal. However, there are provisions in the House bill, that, the most recent version, and there are provisions in the Senate Health Committee proposal that we do think are good for our members, and that we can talk about some of those. We have not endorsed a bill to date. We are still waiting for Senate Finance to come out of the recess so we can see where those bipartisan efforts are going to get us. I know what you've heard, but that was why our COO came out last night with a clarifying statement.